بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وكل ما أفعل آمين يا رب العالمين. My topic today is about talking upper abdomen anatomy basic course, and in this talk part 6 I will talk about the stomach, colon and small bowel in the upper abdomen CT slices. As we see here, we have the stomach here, and the stomach consists of 3 parts, 4 parts or 5 parts. The stomach consists of cardia, fundus, body, antrum and pylorus. The cardia and the fundus is the most superior part of the stomach, and the stomach lies on the left side of the upper abdomen in the hypogastric and epigastric region, and its blood supply comes from the left gastric, splenic as well as hepatic artery, all the branches of celiac trunk. The blood supply is rich with anastomosis, so the ligation of single blood vessels to the stomach usually does not result in ischemia. Distal part of the stomach consists of the body, antrum and the pylorus. The antrum forms the beginning of the distal stomach, and the pylorus is about a 3 cm canal. And the pylorus become hypertrophied in a condition called congenital hypertrophic pyloric stenosis, and the condition present usually in male patient with non-pilus projectile vomiting. As we see here, this is the distal part of the stomach, and this part of the stomach. The colon is formed of cecum, ascending colon as we see here, transverse colon and descending colon. We can see it in the upper abdomen. The ascending colon is a retroperitoneal structure, and has fat-filled tags called appendices epibloquia on its surface, and the inflammation of these appendices epibloquia resulting in appendicitis. The blood supply to the small and large bowel ascending colon mainly derived from the superior mesenteric artery, and cecum has valve that prevent backflow of the fecal material into small intestine. The cecum attached to the appendix, vermiform appendix, with in its medial and posterior part. The arterial supply to the cecum comes from the ileocecal branches of the superior mesenteric artery. Here, this is the descending colon, and this part of descending colon also it is a retroperitoneal structure and has its blood supply from the left colic branch of inferior mesenteric artery. The descending part of the descending and part of the transverse colon and sigmoid colon make up the embryological hindgut. The hindgut takes its blood supply from the inferior mesenteric artery. The descending colon, located on the left side of the abdomen and lies along the left paracolic gutter. This part of colon is connected to the posterior abdominal wall from the splenic flexure to the pelvis. And here again, this is the descending colon, and here this is the ascending colon, and here this is the stomach again, and here we see the descending colon, ascending colon, and the transverse colon. The transverse colon is an intraperitoneal structure, and it is suspended by mesentery called the transverse mesomesentery, and begins from the hepatic flexure and end in the splenic flexure. The hepatic flexure is where the ascending colon turns to transverse colon. The splenic flexure where the transverse colon turns to the descending colon. The transverse colon is the longest part of the colon, and it may dip down to the pelvis, and its blood supply from the middle colic artery, which is a branch of superior mesenteric artery. Here, this is the transverse colon, ascending colon, and here this is the descending colon, and these are the small bowel. And transverse colon, descending colon, and these are small bowel, transverse colon, ascending colon, and descending colon. Transverse colon, descending colon, ascending colon. Here we have the duodenum, and we have the small bowel, descending colon, transverse colon, and the duodenum. The small bowel, this is the longest part of the gastrointestinal tract and usually measures about 6 to 7 meters, and it is forms embryologically from the mid-gut, and it is supplied by the superior mesenteric artery, and it is divided to duodenum, jejunum, and ileum. The small bowel is identified by valvulae circularis or circular folds of the mucosa on the barium study, and it is sometimes referred as a small bowel. In the cross-sectional imaging, the small bowel are identified either filling from the with contrast, as we see here with the diluted barium, or filled with water, and it is located centrally. The terminal ileum is responsible for the absorption of vitamin B12. Here, this is the duodenum, and the duodenum we have. This is the first part of the small intestine and divides into 4 parts. And the first part, it is encased the hepatoduodenal ligament, and the second part or descending part, it is sits behind the transverse colon and anterior to the right kidney and inferior to the liver. It is retroperitoneal structure. The second part also contains ampulla into which the pancreatic duct and common bile duct drain. The first and second and third part of the duodenum forms C shape where the head of the pancreas located. This is the head of the pancreas, and this is the head of the pancreas, and this is the duodenum. The blood supply to the duodenum comes from the superior pancreatic duodenal artery, branches of celiac artery, and inferior pancreatic duodenal arteries, which are branches of the superior mesenteric arteries. Let us see the bowel and another anatomic findings. Here we have the stomach, here we have the ascending colon, here we have the descending colon. As we previously discussed, this is the liver, this is the spleen, and this is the pancreas. Here, this is the transverse colon, ascending colon, distal part of the stomach, descending colon. And here, these are small bowel. Here again, descending colon, stomach, ascending colon, and these are small bowel. Here, this is descending colon, and this is stomach, and this is the transverse colon, and this is the ascending colon. Again, transverse colon, descending colon, ascending colon, and this is the duodenum, and these are the small bowel. Here, this is the duodenum, transverse colon, ascending colon, descending colon, small bowel, transverse colon, small bowel, and this is the duodenum, and this is the descending colon and ascending colon, And here, this is the duodenum, transverse colon, the descending colon, and the small bowel. And thank you very much for listening, and hoping to see you in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.